Hey M&M Planning fam, we are back with Dr. Meyers and Dr. Sarah. We are actually currently in the room that you will come to for your first patient visit, your first time visit here. Can you guys explain what some of the stuff in the room is?
Yeah, so this is our x-ray machine. So if you come in, we'll do a few vital signs, get a brief history of what's going on, as well as determine if you're a candidate for x-rays, if we want to look at the structural of it, and we'll kind of determine what's going on with you on your bone level, more than just your symptoms.
Yeah, so we have a digital unit, which is it's very fast, and we can figure out what's going on in your particular issue very quickly. We also do adjustments in this room and kind of an overall exam, x-ray, and adjusting.
Okay, so today's video we're going to be talking some more about the physical and mental health benefits of chiropractic and acupuncture work. So that is my first question for you guys, is what are the major physical benefits that come from chiropractic?
God, there's so many others.
If you can summarize.
So when we're talking about, if we get really down to the basics, just like in our previous video, when you look at what it is exactly that we're looking for misalignments within the bony structure of your body that could be impinging on the nervous system. And once we correct that impingement and we can allow the nervous system to function properly, you, the patient, can express health to the best of your ability, which is phenomenal. Now, what does that mean? It means that, first of all, you're going to be out of pain, but also you're going to be feeling better. You're going to have a brighter outlook. Your mental health is going to be better. Why? Because you don't have nerve interference. This is where we start seeing patients are able to go back to exercising. And we know that if you can exercise without pain, your endorphin levels are actually increased, so you feel better. It's a vicious cycle in the right direction. So we stop the condition that's causing the problem by correcting the misalignments, and then things can actually start to flow better again.
I remember Dr. Meyers. So I've been a patient of Dr. Meyers for a long time. Like I was saying before, I had some medical issues when I was in college. We ended up finding out that this hip was way higher than the other one, and that is what was causing all my medical issues. But when you were talking with me, you talked about how within the spine itself, the tissues in between throughout history, the cartilage, they did tests back a long time ago when all of this was developing, and pretty much the more that the nerves were pinched because the discs weren't there or they had degenerated, the more you saw issues like heart attacks or kidney failure or things like that. So what other disorders, when you're out of alignment, could be caused?
So it's interesting you should bring that up, Megan, because there was a research study done a long time ago. I think it was back in the 20s, correct me if I'm wrong. And what they did is they took cadavers, they took people who had passed away from certain disease processes. Some people had passed away from heart disease, other people with kidney disease, other people with liver disease. And they were interested in finding out exactly what was the condition of the nerve that went to that particular diseased organ, whether it was the heart, the kidney, the liver, and they wanted to trace it back to see if there was any correlation between the nerve and that organ. And what they found was amazing, because the people who had passed away with heart disease, when they looked back, they found that nerve going to the heart had actually degenerated to a degree that it was not giving the proper information to the heart. Now, I give you this question. Was it indeed the heart that was diseased, or was it because it wasn't getting the right information from the brain down the spinal cord out that nerve to beat in the right fashion? Same thing was happening with the liver. The person who had died from the liver disease, they traced back the nerve, and they found that the nerve was actually compromised. It was irritated. It was not getting the proper information. So it was a communication error from the brain down the spinal cord and out that spinal nerve. Now, if it just happened, irritation on the nerve, we can go ahead and correct it. But how about if it was years and years and years, and that led to misfunction and malfunction of that particular organ, whether it was the liver, the kidney, the heart, whatever it might be. So, you might say, oh, I've got a pinched nerve, but, a couple of Tylenol, that'll take care of it. don't underestimate what damage that nerve irritation can actually do to the organs and actually to the brain.
I was just going to point that out. This actually shows that every single nerve that comes in your body that innervates everything from your bladder to your adrenals to your kidneys to your heart all comes out of that center spinal column. And that's why we focus on the spine mainly in here. Because if you have numb fingers, that's coming from a specific nerve root in your neck. So we've studied what nerves innervate what. We can kind of diagnose with your symptoms and see what possibly could be going on.
So if we can make a quick list of possible disorders, like let's go with 5. Let's see if we can do 5. What would be some top 5 disorders that would be like boom, 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 boom?
We've seen so many. We've seen one particular disorder is infertility. Couples can't get pregnant because of irritation on a nerve that's going down into the reproductive organs. Colon it's very common. We see people coming in who cannot go to the bathroom on their own. They have to take laxatives. But with an adjustment, we can actually relieve the interference. And if that's where the problem is, then things start to flow again. Function starts to happen. They can go to the bathroom.
It's actually true with babies too. That's one of the miraculous things about babies. A lot of times if they come in, they're constipated. After one adjustment, we always tell the mom, they might have a big bowel movement before you even leave the office because they respond so quickly to chiropractic care.
Wow, that's amazing.
Now, obviously, one of the big ones is headaches and migraines. It's near and dear to my heart and Dr. Sarah's as well. We see multiple patients come in with migraines. Had a lady that came in, just as an example, she came in on Friday, and I hadn't seen her for a long time. She was a previous patient, hadn't seen her for a while, and she was in a constant migraine for 30 days. 1 month, she was in a constant migraine. Now, she had been to see her neurologist, she had been to see her medical doctor, she had been to see various other medical professions, and she realized at some point, well, after 30 days, she realized, maybe I need to go see my chiropractor. So she gave a call, she came in, and she got her adjustment, and she left, and we saw her again today actually. So this is Monday. We saw her Friday, we saw her again Monday. She said so much difference. She felt so much better. Now, she hadn't felt good in 30 days after taking all the medication and all the things, but after one adjustment, she started feeling so much better. She couldn't believe what a difference it was.
Wow.
And part of that is when you adjust specifically the cervical region, it actually releases more blood to the brain directly, which is what allows you to start feeling better almost instantly a lot of times.
Oh my gosh. See, this is why I love coming here. Again, with all the issues that I've had, Dr. Meyers has helped me with the majority of all of them when other doctors haven't been able to. But what I love most about what these guys do here is they're going to educate you along the way. That makes me feel so comfortable. Like as a culture-loving adventure seeker, I love to learn. So just being able to sit here and talk with you is half of what I enjoy whenever I come into the office. So what about some mental health benefits? What are some mental health benefits? Because I'm assuming already from what I'm hearing, that relief of pain is one thing that's going to take anxiety off your mind. But are there any mental health benefits? Because we talked about physical.
Well, you know, we have a lot of patients that come in with anxiety, with depression, with other forms of mental health, and specifically with the acupuncture that we do. Acupuncture has been shown to work to help hundreds and hundreds of conditions. The World Health Organization has recognized it, and it's the major form of healthcare in Asia. But we have helped many kids actually with autism through acupuncture. Now, they're coupled together. The acupuncture and the chiropractic adjustment, again, we're not compartmentalizing this. This is part and parcel of the whole treatment that you get. But we will certainly analyze the spine, we'll figure out what's going on, relieve any interferences that the patient has, and then proceed with specific acupuncture treatments for the condition. And we've seen patients who, just to give you an example, an 11-year-old, a little girl who had a sensory disorder. She couldn't stand to feel certain fabric. She was very shy, very introverted, and didn't want to talk. She would be very reluctant to actually even come and say hello. Yeah. And now she brags about, look at my new dress, look at my new shoes. She's ready. She comes in. She talks to the front staff. She talks to us. She's really doing fantastic. Obviously, her mother is delighted with that.
Yeah, I'm sure. I mean, and just again, from when you feel better physically, it helps mentally. Again, sort of like what we talked about in our first video. the stress that comes on us, the emotions, the anxiety that brings with it, it does tap into parts of your body, and so being able to relieve those, even just for a minute, how much anxiety that gets off your mind.
Of course.
And I've noticed that during my own treatment, how frustrated I can be when I feel like something's not working, and then you stay in that state of anxiety. So just being able to know that you can feel better. There are solutions.
Symptoms are usually what bring people in, and then the whole nervous system is what keeps them staying here.
Right? So, okay, we have one more question. Let's see, how does the culture that developed this type of work practice mental health? And do you see a correlation between chiropractic work, how it was developed, and the mental health practices we have in our own culture today? That's a lot.
That's a loaded question. So let's address it first with the culture that first developed and discovered chiropractic or spinal adjustments. And we can talk both about the Greek culture, the Asian culture.
Mm-hmm.
So in the Greek culture, they actually, as we had talked about in the previous video, in the Greek culture, they realized that you have to look to the spine for disease processes. They don't just pop up. There's reason, there's cause. And in chiropractic, the art of chiropractic and the theory of chiropractic, there's only 3 ways that you can have a spinal misalignment. Only 3. One is mechanical, and I think everyone knows what this is. You're walking around, you fall, or you have some type of a trauma and you knock something out of alignment, right? We all can understand that part. Number 2 is a chemical imbalance.
Interesting.
So a chemical imbalance can actually cause you to have misaligned vertebrae. And this is where we know that a chemical imbalance can, like whether it's recreational drugs or prescription drug, opioids, diet, all of that can actually misalign your vertebrae. And the third component is the mental component. And this is where stress comes into play, right?
What I said earlier.
What you said earlier, exactly right. Stress is such a big, it's a killer. It's the silent killer.
Yeah.
Because we don't put the emphasis on how much stress this culture has, and we are under a lot of stress. We're designed to, we can grin and bear it. We're Americans, we can do anything, right? But the fact of the matter is, how you handle your stress and how your body actually handles your stress is really big. I mean, it does no good if you're the CEO of, Fortune 500 company and you keel over with a heart attack because of the stress, right? So you have to develop certain ways to manage the stress. In the East, and I'll talk specifically about in Asia, again, they look at health as the whole body. If something is imbalanced, and what acupuncture actually deals with is balance. Simply put, it's about balance. Not too much, not too little. All about the balance.
That's what the Greek believed too. Balance.
Yeah, absolutely. It was all about the balance. So bringing it home to the West, do we actually, and I guess the question was, do we do this in the West? And the answer is slowly, I think things are starting to change.
Yeah.
Right? There's more and more patients that are coming in asking about chiropractic and acupuncture. So I think the culture is changing. It is slow, but I think that it is changing.
Well, guys, we are going to be doing some more videos ourselves talking about the myths. Because again, sometimes we think, because this happened or was created elsewhere, oh my gosh, it's scary. We're gonna bust some myths for us here in another video. But thank you guys again so much. This has been so wonderful, and we have more to come. We'll see you guys.